And millions of Americans are getting immunized every day, but pharmacy groups say that there are still simple ways we could vastly improve our vaccine supply. Our ABC 10 News anchor Derek Stahl is going in depth on two changes that could free up hundreds of thousands of doses.
You may have heard that back in December, pharmacists across the country noticed vials of the Pfizer vaccine were overfilled. Every 5-dose vial had enough vaccine for one extra dose, sometimes two, if they had the right equipment to extract it.
We treat this as liquid gold, so we do not waste any drops.
Same story with the Moderna vials. Their 10-dose vials often had enough for 2 extra doses. The issue was having the right syringe for the job. But all these months later, vaccinators say the federal government still isn't consistently sending them the right syringes, leaving some hospitals scrambling to buy them for themselves and forcing others to let bonus doses go to waste. Michael Ganio is with the American Society of Health System Pharmacists.
It's just easier to measure. It's more accurate to measure using a smaller device when possible.
To get as many doses as possible, pharmacists want a small syringe with an extra feature.
This is a normal syringe. There is a large amount of leftover liquid compared to this syringe where there's just a tiny bubble on the top.
The ideal option is one with a narrower plunger that leaves less space for leftover vaccine to get trapped, what's called a 1 ml low dead volume syringe. But they've been in short supply. In January, President Joe Biden invoked the Defense Production Act to ramp up production. Since then, the federal government has been shipping Pfizer kits with the 1 ml syringes, but the Moderna kits haven't changed. They still include a standard 3 ml syringe without the low dead volume feature.
There's not enough of all of one device to go around for everyone right now.
But Ganio says one policy change could make a huge difference overnight, allowing pharmacists to combine leftover vaccine from multiple vials into one dose, a technique called pooling.
Under specific conditions, we think it's possible to combine that half dose with a half dose from another vial. And, you can increase the number of patients that you're immunizing by about 10%.
An extra 10% would make about 300,000 more doses available per day. But the FDA has resisted calls to allow pooling, says Dr. Christian Ramers of Family Health Centers of San Diego.
That brings in sort of an infection control risk. These vaccines are preservative-free. So a fungus or a bacteria or something could get in there, and you don't want to be mixing and have the possibility of contamination.
Pharmacy groups say pooling has been done for years with other vaccines and argue it can be done safely with simple precautions. Between that and using the right syringes, experts say we could speed up vaccination efforts even more, allowing the U.S. to share more doses with countries around the world. Derek Stahl, ABC 10 News.